What's up, YouTube? I have made this, see if I can see it, diagram of the history of my back. Um, Really, I take it back about 6 or 7 years to try to uh, recreate a more specific and useful narrative of my back pain, and to also kind of broaden the scope of possible um, causes or relationships of that might be generators of the pain. And I think I would like to start off the story by saying that um, yeah, I don't know. When you talk about my back pain, the first point of back pain, I have like these two peaks that you're not going to be able to see too well, but there's one right there and then one right there. And this goes back to like about 2005 was the first one that I remember standing at a concert with both legs perfectly flat on the floor. See if you can see. Perfectly flat on the floor, and I started noticing that as I would stand there for a while, half an hour, I would have to shift my hips. I would have to stand like this, and then I'd have to go like this, and then like this, and like this, and and that was the first thing. And then about a year later, I remembered having my first bout of chronic pain. It lasted about 2 weeks. It seemingly came from nowhere. I thought the cause was running. Stopped running. Eventually, I just stopped doing sit-ups. So I ended up thinking the pain was sit-ups, and I think that I was good for about a year or 2 years after that. I really can't remember if it was a year, to the point at which we get right here on this map, and that's when the chronic pain set in full, and it's been 4 years. And I think the most significant, as I show on here, it's on this top one. It's been straight uphill since then for like about 2 years, and then there was a huge decrease as I got the leg length in my shoe, or I got the lift in my shoe to correct the leg length. And then there was this one moment that happened about 3 months ago. I was feeling so good, I decided that, hey, I feel so good, I'm going to just start back to normal routine, normal lifting. I'm just going to see how it goes. And it took about 2 days before, as you see right here, I started this downhill plane again. But as you can see on here, let's see if you can see the peak I'm trying to show here. I am much better than I was 2 or 3 years ago. Though I do see some similar symptoms creeping back into everything, that now pain seems to be creeping back up into my lower back. But overall, and there seems to be more popping in my the top part of my femur, my femoral head. There seems to be a lot of popping in there, which has been, it kind of went away on this map. It started going away as soon as I got the leg length. It started, at this low point down here, right there, there was actually no popping in anymore. The popping had all gone away, and the minute I re-injured it, popping came back, and so it's, my symptoms now are interesting because I'm starting to get some of this upward swing again, which is I'm putting that upward because there's moments at the end of the day when my lower back, middle quadratus lumbarum, middle of it, upper of it, there's like 2 or 3 trigger points in that extend from the top of my the bottom of my rib cage to where the top of my sacrum is, that they kind of pinch up, and they start spasming, and to me it seems to be a result of it just seems that it squeezes up like that to prevent the weakness of my sacroiliac area, the muscles and the ligaments there, from spasming. And the reason why I say that is because about the time right before I got my MRI, I have a couple of these little peaks right here. Actually, the most pain I've ever had in my back was about 2 years ago, right before everything started getting really bad, that I went on Flexerol, which is a muscle relaxer, and I just decided because I got this MRI and nothing came up, and the pain still came back, and this doctor was trying to tell me that it was all in my head. Well, no, that came afterwards, but after nothing came up on the MRI, I was just like, okay, this doesn't make any sense. So I went on Flexerol for an entire week, and loosened up all the trigger points in my body because I stayed on the muscle relaxer for a whole week, and I felt a distinct point at which my SI joint, it was like almost like something just was out of place and just went back into place or something, and then it seemed very evident that the issue was in once I loosened everything up to I was kind of seeing like, what if I loosen all these trigger points up, where will the weak point be? And it seemed to me that it was in my SI joint. And so after the week, I just went cold turkey off the muscle relaxers and stopped taking them, and at about 3 hours after doing that, it was like I felt the muscles in my SI just rip, just completely tear. And the only other time I felt anything like that was like at this point right here, right there, when I re-injured it a few months ago. That was the only thing similar, but definitely the time before it was a lot more painful. It was so painful, in fact, that I couldn't even walk, and I thought I was like crippled. I went and got crutches, and it went away in a few days. It was like the spasming went away, and so yeah, that was to me that was a significant point in my diagnosis process, and that kind of led me to really focusing on the sacrum, and it was me that kind of came to that conclusion to do that. Although the pain, I know the pain for the year after that was all up in my my lower back, which was the quadratus lumbarum, the trigger points that I have there, which seemed to be a result of facets or something, pinching or something pinching. But there was always like really big trigger points where all this pinching happened, like huge trigger points, like you could feel them like the size of the golf ball or something. So anyway, so that's one aspect of the evolution of my back, and in this next video I'm going to talk about something else.